Thank you, Mr. Chairman. Madam Secretary Designate, welcome.
Thank you.
As chairman of the Aging and Older Adult Services Committee, I have a particular concern or oversight responsibility over the Pennsylvania Lottery, since it was dedicated to our seniors since its inception back in the early 1970s. In reviews that I've seen with regard to the lottery, it seems the administration is predicting some sorts of deficits within the next 2 years. 2 years ago, in 2013, we heard from the Legislative Budget and Finance Committee, pursuant to a House Resolution 106 sponsored by Representative Causer, and their report to the legislature 2 years ago said that the lottery was healthy. At least they were limited statutorily to saying 5 years into the future, but they told us that essentially it's healthy even beyond 5 years. As long as we didn't do two things, as long as we didn't change the level of the prizes that were being offered, as long as we didn't increase the number of people that would be drawing down upon those lottery funds. The legislature has done neither. And yet in the reviews I've seen, the administration is now saying that there may be deficits in as soon as 2 years down the road. How can, and I don't mind if you defer this question to Mr. Sfitko or anybody else there, but how can this administration's predictions with regard to the health of the financial health of the lottery be so divergence with the LBFC study, which told us, as I said, that it's healthy as far out as they can see, certainly for the next 5 years?
Well, I think there's a couple of things going on there. And one is that you have to differentiate the health of the lottery, which is very healthy, from the lottery fund. The lottery fund is where expenditures are paid from. And some of those expenditures that have been transferred into the lottery fund have grown at a rather phenomenal pace. Some of the expenditures that go towards, for example, home health care went from about $20 million in 13-14 to, was it $160 million in 14-15. We have scaled that back. I think they're, $109 million this fiscal year.
I'm sorry, could you speak up just a bit? It's hard to hear you.
I'm sorry. The expenditures for some programs in the Department of Human Services that have been transferred into the lottery in the past have grown at a rate quite a bit faster than the rate of growth of the lottery fund overall. They went from $20 million in 13-14 to about $163 million in 14-15 and have been reduced in this year's budget proposal to $106 million. But a rate of growth that high is something that the rate of growth of our lottery cannot keep up with. That doesn't mean that there is a problem with the lottery. It means that there are a lot of expenditures being put into the fund that the growth in the lottery is not able to absorb. As far as the lottery itself is concerned, we are running somewhat behind estimated collections this year, but we're still ahead of the prior year by 3.7% overall. So the lottery is growing, and we have plans in place to make it grow faster, which I will ask Drew to describe to you. But the problem is not the lottery, it's the amount of funding coming out of the lottery fund.
Okay.
Mr. Chairman, I can tell you about some plans that we have to grow the lottery. To the Secretary's point, the lottery fund is comprised of other sources other than the lottery, but acknowledging that our job is to responsibly generate as much profit as we can for those important programs. We have a number of plans for the coming year. We have an aggressive plan already in the process to modernize the lottery, to take advantage of new technologies available to us now, to optimize many different facets of our business, as well as expanding the number of retailers. We want to We asked for the governor's help, as a matter of fact, to recruit some big box retailers, and with the help of the legislature, would like to put machines to license for lottery sales the state liquor store system. So we have a lot of opportunities for growth ahead of us, a lot of plans to get there, and we look forward to working with the legislature and the administration to making that happen.
Well, thank you, Drew, for those comments. Let me point to something in specific. In terms of the Health and Human Services, Human Services budget items, a quick review of that indicated that long-term care increases were going to be offset by reductions of $25 million in lottery funds. And in the home and community-based services, the reduction from the lottery was $57 million. Home and community-based services and even long-term care are used by people throughout the adult age span, from 18 to whenever they pass away. But you're using lottery funds, we're dipping into lottery funds and using it to balance the budget. What assurance do we have that the money that's drawn down from the lottery fund in both those cases is going to be used to provide care for the elderly, as is the statutory requirement when the lottery was created?
Right.
How do you differentiate? How do you take $60 million out of the lottery fund, put it into home and community-based care, that item in the budget, and then say it's only going to be used for the care of the elderly as opposed to anybody else who's under the age 60?
I think you'd have to ask that question. I think you would have to ask that question of the budget secretary.
Of the budget secretary?
Yes, thank you.
Okay. Do you have any plans at all, or do you have any? Maybe Drew, do you have any way to assure that the money that's drawn from the lottery gets applied in a particular way or toward a particular facet of our population?
Well, to the Secretary's earlier point, there's a difference between what the lottery does and the lottery fund, and we don't administer or manage that fund in any way. Our job is really just to bring more revenue into it in a responsible way. So the Budget Office oversees that fund and how the funds are broken up.
Okay.